Hello there, Brian Bingham. I'm an ear, nose and throat surgeon. I've been a consultant in Glasgow, South Glasgow hospitals now for about 29 years. Typically, I see people with blocked noses, people with hearing loss, people with pain around their throat, around their ears, and people with minor difficulties in swallowing. Well, we start with a good assessment and proper diagnosis, allowing the patient to understand what the problem is, and then we tailor the treatment to the cause of the problem, which may mean simple reassurance through to investigation with scans, and in some people moving on to an operation in the operating theatre. The pathway that somebody follows depends on what the problem is and what needs to be sorted. So that might be simple reassurance through to going for an assessment for a scan, through an instigation of some treatment and follow-up, or even an operation. In ear, nose and throat, there is always a concern that you could have cancer. That is now one of the biggest concerns in the population. And the job in the outpatient clinic is to make sure that somebody understands what their diagnosis is, and where it is not a serious or sinister problem, to tell them it's not a serious or sinister problem. Well, I have now worked here for 29 years and it is extremely comfortable for me. There are so many nice staff, both administrative and nursing staff, that for me, it gives me a great deal of satisfaction to work here, and it's the only thing that keeps me off the golf course.